Which of the following diuretics is associated with hyperkalemia? A. Hydrochlorothiazide. B. Furosemide. C. Spironolactone. D. Atacranic acid. The correct answer is C. Spironolactone is a potassium-sparing diuretic that blocks the action of aldosterone in the distal convoluted tubule. This prevents sodium reabsorption and potassium secretion, leading to potassium retention and potential hyperkalemia. A patient with a sulfa allergy is prescribed a diuretic. Which of the following medications should be avoided? A. Amiloride. B. Hydrochlorothiazide. C. Spironolactone. D. Triamterene. The correct answer is B. Hydrochlorothiazide is a thiazide diuretic, which is chemically related to sulfonamides. Patients with sulfa allergies may exhibit cross-sensitivity to thiazide diuretics. Which diuretic is most effective in a patient with severe renal impairment, glomerular filtration rate less than 30? A. Hydrochlorothiazide. B. Spironolactone. C. Metolazone. D. Furosemide. The correct answer is D. Loop diuretics, like furosemide, retain their efficacy even in patients with severe renal impairment, making them the preferred choice in such cases. Which of the following is a potential adverse effect of carbonic anhydrase inhibitors? A. Metabolic alkalosis. B. Hypercalcemia. C. Hyperkalemia. D. Metabolic acidosis. The correct answer is D. Carbonic anhydrase inhibitors, such as acetazolamide, block the reabsorption of bicarbonate in the proximal convoluted tubule. This can lead to metabolic acidosis due to increased bicarbonate excretion. A patient with cirrhosis and ascites is prescribed a diuretic. Which of the following combinations is most appropriate? A. Furosemide and amiloride. B. Spironolactone and hydrochlorothiazide. C. Furosemide and spironolactone. D. Hydrochlorothiazide and amiloride. The correct answer is C. A combination of a loop diuretic, furosemide, and a potassium-sparing diuretic, spironolactone, is often used in patients with cirrhosis and ascites. This combination effectively reduces fluid retention while minimizing the risk of electrolyte disturbances, particularly hyperkalemia. Which of the following diuretics is most likely to cause ototoxicity? A. Hydrochlorothiazide. B. Atacranic acid. C. Spironolactone. D. Triamterene. The correct answer is B. Atacranic acid, a loop diuretic, is known to have a higher risk of ototoxicity, hearing damage, compared to other diuretics. A patient with a history of gout is prescribed a diuretic. Which medication should be used with caution? A. Furosemide. B. Amiloride. C. Spironolactone. D. Hydrochlorothiazide. The correct answer is D. Thiazide diuretics, like hydrochlorothiazide, can increase serum uric acid levels, potentially exacerbating gout in susceptible individuals. Which of the following is not a mechanism of action of diuretics? A. Inhibition of sodium reabsorption. B. Increase in glomerular filtration rate. C. Osmotic diuresis. D. Inhibition of carbonic anhydrase. The correct answer is B. Diuretics primarily work by reducing sodium reabsorption in various parts of the nephron, leading to increased water excretion. While they can indirectly affect glomerular filtration rate in some cases, it's not their primary mechanism of action. A patient with hypertension is prescribed a thiazide diuretic. Which of the following laboratory abnormalities is most likely to occur as a side effect? A. hypocalcemia, B. Hypercalcemia, C. Hypoglycemia, D. Hyperglycemia. The correct answer is B. Thiazide diuretics can decrease urinary calcium excretion, leading to mild hypercalcemia. This effect is often beneficial in patients with osteoporosis but can be a concern in those with pre-existing hypercalcemia. Which of the following diuretics is indicated in the treatment of nephrogenic diabetes insipidus? A. Furosemide, B. Hydrochlorothiazide, C. Amiloride, D. Mannitol. The correct answer is B. Thiazide diuretics, paradoxically, can reduce urine output in patients with nephrogenic diabetes insipidus. The exact mechanism is complex but involves a combination of reduced glomerular filtration rate and enhanced sodium reabsorption in the proximal tubule. A patient with primary hyperaldosteronism is being considered for diuretic therapy. Which diuretic is most likely to be effective? A. Furosemide, B. Hydrochlorothiazide, C. Spironolactone, D. Mannitol. The correct answer is C. Spironolactone, a potassium-sparing diuretic, directly antagonizes the effects of aldosterone. It is particularly effective in conditions where aldosterone excess is a contributing factor, such as primary hyperaldosteronism. Which of the following is a recognized adverse effect of potassium-sparing diuretics? A. Hyperkalemia, B. Metabolic alkalosis, C. Gynecomastia, D. Hypernatremia. The correct answer is C. Spironolactone, a potassium-sparing diuretic, can bind to androgen receptors, potentially leading to endocrine side effects such as gynecomastia, breast enlargement in males. A patient with acute pulmonary edema is given intravenous furosemide. Which of the following is the primary mechanism by which furosemide provides rapid relief in this situation? A. Direct inotropic effect on the heart. B. Reduction in preload. C. Decrease in afterload. D. Increased renal blood flow. The correct answer is B. Intravenous furosemide rapidly reduces venous return to the heart, preload, by promoting venodilation. This effect precedes its diuretic action and helps relieve pulmonary congestion quickly. Which of the following diuretics has the shortest duration of action? A. Furosemide, B. Bumetanide, C. Torsemide, D. Indapamide. The correct answer is B. Bumetanide, a loop diuretic, has the shortest duration of action, approximately 4-6 hours, compared to other commonly used loop diuretics. A patient receiving long-term hydrochlorothiazide therapy complains of muscle weakness and fatigue. Which of the following electrolyte imbalances is the most likely cause? A. Hyperkalemia, B. Hyperkalemia, C. Hypomagnesemia, D. Hypermagnesemia. The correct answer is C. Thiazide diuretics can increase urinary magnesium excretion, leading to hypomagnesemia. Muscle weakness and fatigue are common symptoms of this electrolyte disturbance. Which of the following is not a contraindication to the use of mannitol? A. Anuria, B. Severe congestive heart failure, C. Active intracranial bleeding, D. Acute renal failure with oliguria. The correct answer is C. While mannitol is generally contraindicated in most cases of renal failure, it can be cautiously used in patients with active intracranial bleeding to reduce intracranial pressure. However, close monitoring is essential. A patient with glaucoma is prescribed a diuretic. Which of the following medications should be used with caution? A. Hydrochlorothiazide, B. Furosemide, C. Acetazolamide, D. Spironolactone. The correct answer is C. Acetazolamide, a carbonic anhydrase inhibitor, can worsen glaucoma by increasing intraocular pressure. It is generally contraindicated in patients with this condition. Which of the following diuretics is least likely to cause hyperkalemia? A. Furosemide. B. Hydrochlorothiazide. C. Clothianidin. D. Amiloride. The correct answer is D. Amiloride is a potassium-sparing diuretic that blocks sodium channels in the distal tubule, preventing potassium secretion. It is less likely to cause hyperkalemia compared to loop or thiazide diuretics. A patient with type 2 diabetes mellitus is prescribed a diuretic. Which medication is most likely to improve glycemic control? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Acetazolamide. The correct answer is B. Thiazide diuretics, like hydrochlorothiazide, can modestly improve glycemic control in patients with type 2 diabetes. The mechanism is not fully understood but may involve improved insulin sensitivity. Which of the following diuretics is most likely to cause hyponatremia? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Triamterene. The correct answer is A. Loop diuretics, like furosemide, can lead to significant sodium loss, particularly when used in high doses or for prolonged periods. This can result in hyponatremia, especially in patients with restricted sodium intake. A patient with hypertension and hyperkalemia is prescribed a diuretic. Which of the following medications is the most appropriate choice? A. Furosemide. B. Hydrochlorothiazide. C. Amiloride. D. Metolazone. The correct answer is C. In a patient with pre-existing hyperkalemia, a potassium-sparing diuretic like amiloride is the most appropriate choice to avoid further potassium depletion. It can be used alone or in combination with a thiazide diuretic. Which of the following diuretics is most effective in reducing urinary calcium excretion? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Acetazolamide. The correct answer is B. Thiazide diuretics, like hydrochlorothiazide, decrease urinary calcium excretion. This effect is often beneficial in patients with hypercalciuria or a history of calcium-containing kidney stones. A patient with a history of lithium therapy is prescribed a diuretic. Which medication is most likely to increase serum lithium levels? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Acetazolamide. The correct answer is B. Thiazide diuretics, like hydrochlorothiazide, can increase lithium reabsorption in the proximal tubule, leading to elevated serum lithium levels and potential toxicity. Careful monitoring is necessary when these medications are used concurrently. Which of the following diuretics is classified as an osmotic diuretic? A. Furosemide. B. Hydrochlorothiazide. C. Mannitol. D. Spironolactone. The correct answer is C. Mannitol is an osmotic diuretic that works by creating an osmotic gradient in the renal tubules, drawing water into the urine and increasing urine output. A patient with congestive heart failure is being treated with a loop diuretic. Which of the following electrolyte abnormalities is most likely to necessitate discontinuation of the diuretic? A. Hyperkalemia. B. Hyponatremia. C. Hypomagnesemia. D. Hypocalcemia. The correct answer is A. Severe hyperkalemia can increase the risk of life-threatening cardiac arrhythmias, especially in patients with heart failure. It is often the most concerning electrolyte abnormality that necessitates dose adjustment or discontinuation of loop diuretics. Which of the following diuretics is most likely to cause hyperuricemia? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Acetazolamide. The correct answer is B. Thiazide diuretics, like hydrochlorothiazide, can increase serum uric acid levels. This is usually not clinically significant but can be problematic in patients with a history of gout. Which of the following is not a recognized adverse effect of loop diuretics? A. Ototoxicity. B. Hyperkalemia. C. Hypernatremia. D. Metabolic alkalosis. The correct answer is C. Loop diuretics tend to cause hypernatremia, low sodium levels, due to increased sodium excretion, not hypernatremia, high sodium levels.